Good morning everyone. Today I am going to take a small lesson on puerperal sepsis. My name is Chime Dolkar. I am a lecturer of Department of OBG Nursing, Yenepoya Nursing College, Yenepoya deemed to be university. Before moving on to the main topic, let us see the learning objective for today's class. At the end of the class, students will be able to define the puerperal sepsis, explain the predisposing factor and etiology, describe the pathogenesis of puerperal sepsis, list the diagnostic measures, discuss on the management of puerperal sepsis. Moving on to next, let us see the introduction on puerperal sepsis. Sepsis is the presence of harmful bacteria and their toxin in the tissue which may have entered through infection of a wound into the bloodstream. So if the sepsis occurs during the puerperium or during the postnatal period, it is known as puerperal sepsis. Definition on puerperal sepsis. According to WHO, puerperal sepsis is defined as infection of the genital tract occurring at labor or within 42 days of the postpartum period. Another definition given in the DC Datta textbook, an infection of the genital tract which occur as complication of delivery or miscarriage is also termed as puerperal sepsis. So these are the primary site of infection, which includes uterus, cervix, vagina and the perineum. Next, we will be looking into the predisposing factors of the puerperal sepsis. So this predisposing factor can be categorized into three factors: antenatal, intranatal and postnatal. As for the antenatal factors, poor general condition and malnutrition, anemia, lower socioeconomic status, elderly pregnancy, premature labor, PROM, that is premature rupture of membrane, antepartum hemorrhage, immunosuppressive state such as in case of HIV/AIDS and other pre-existing medical conditions. Next, moving on to the intranatal factor, cesarean delivery, serial vaginal examination, that is continuous doing the vaginal examination or frequent vaginal examination which is not performed under the aseptic technique, prolonged labor, then operative and instrumental delivery, twin pregnancy, dehydration. Last, that is the postnatal factor, postpartum hemorrhage and retained bits of placenta. So these all three factors can be considered as the predisposing factor. Next, we will look on to the etiology of the puerperal sepsis. So first one is repeated vaginal examination during the labor, rupture of membrane, prolonged obstructed labor, blood in the uterine cavity, infection from vaginal flora, infection with intrinsic and extrinsic microorganisms. So what are the microorganisms or the causative organisms which are present or which causes the puerperal sepsis? This also could be categorized as aerobic, anaerobic and others. In the aerobic, it comes Group A beta hemolytic streptococcus GAS, Group B hemolytic streptococcus GBS, methicillin resistant streptococcus aureus MRSA, and in the anaerobic streptococcus, peptococcus, bacteroides, fusobacteria and clostridia, and in others streptococcus pyogen, E. coli, chlamydia and neisseria. Among this, streptococcus pyogen is one of the common microorganism which causes the puerperal sepsis. Next, the sources of infection. So we have discussed about the microorganism, but from which sources they can come and cause the puerperal sepsis. So it can be again categorized as three: endogenous, autogenous and exogenous. Endogenous, that's the infection which is carried from the vagina and the cervix. Autogenous, infection which is carried to the genital tract from other body part directly or through the hematogenous route, that is from the bloodstream. Exogenous, that is from direct contact from animated and inanimated, that is living or the non-living objects. Next, we will be seeing the pathogenesis. So, in the puerperal sepsis, first the endometrium, cervical lacerated wound, vaginal wound or perineal wound. These are some of the favorable sites for the bacterial growth and multiplication. The devitalized tissue, blood clot, foreign body and surgical trauma, this all favors the polymicrobial growth and proliferation, which causes the spread of infection. So this infection is known as the puerperal sepsis, which can be in any of the sites such as metritis, parametritis, endometritis and cellulitis. Spread of infection, as I said in the previous pathogenesis, so same the puerperal sepsis, some infection can be occur in the specific area, that is parametritis, that is the lining of the uterine wall, then pelvic peritonitis, that is inflammation of the peritoneal sac, pelvic abscess, if it doesn't treat properly, it may cause the abscess or pus formation. Next is salpingitis, that is the inflammation of the fallopian tube, and ovarian abscess. Sometimes the inflammation from the fallopian tube may cause inflammation of the ovary and also causes the ovarian abscess or pus formation in the ovary. Signs and symptoms. So signs and symptoms of the puerperal sepsis, either it could be a local infection which is present over the specific area or the localized area, or it could be a uterine infection. Local infection. So signs and symptoms of local infection, the classic sign of infection is there will be an increase in temperature, generalized malaise, headache, local wound become red and swollen, pus formation, chills and rigor, and seropurulent discharge also may be present. Next, in the uterine infection. So uterine infection, it could be either mild infection, mild symptoms will be there, severe infection, severe kind of symptoms will be there. Mild infection includes symptoms such as fever more than 100.4 degree Fahrenheit, tachycardia, lochial discharge which become offensive and copious, uterus is subinvoluted and tender. In the severe cases, high fever with chills and rigor, rapid pulse, breathlessness, cough, abdominal pain and dysuria. Here the lochia become scanty and odorless, subinvoluted uterus, tender and soft it will be. Diagnostic measures. Once we have seen the clinical signs and symptoms, diagnostic measures which will be underlying the principle, that is to locate the site of infection, to identify the organism and to assess the severity of the disease. So diagnostic measures include, first one, history collection. So here we are collecting the history during the antenatal, intranatal and the postnatal period. Next, moving on to the physical examination, which includes general as well as systemic physical examination. Investigation, high vaginal and endocervical swab for culture and sensitivity test can be done, or clean catch midstream specimen of urine for the culture and sensitivity, blood investigation and blood culture. Other investigative measure includes pelvic ultrasound, CT and MRI, chest X-ray and laparotomy. So after the diagnostic measures, we will be moving on to the treatment modalities or the management. So the treatment or the management, it could be preventive measures or curative measures. Preventive measures, first the preventive measures that includes antenatal prevention, intranatal prevention and postnatal prevention. In antenatal prevention, improve the nutritional status of the mother during the antenatal period, and pregnancy immunization, that is tetanus immunization the mother should take. Correction of malnutrition, if the mother is malnourished, correction of malnutrition by providing a balanced diet and good calorie diet. Health education on institutional delivery, screening of any obstetrical complication if any. Intranatal, using the aseptic delivery technique, avoiding unnecessary vaginal examination, avoiding unnecessary catheterization, give proper perineal support during the time of labor, avoid unnecessary induction of labor by ARM, that is artificial rupture of membrane. If there is a presence of premature rupture of membrane or catheterization or excessive vaginal examination, prophylactic antibiotics to be started. Preventive measures in the postnatal: perineal care, proper perineal care to be given, maintain good personal hygiene, limit the visitor during the postnatal period, look out for early sign of infection. So these are some of the preventive measures. If the puerperal sepsis already occur, what is the treatment modality or the curative measure, we will see. So in this, general care, that is isolation and bed nursing, bed rest, oral rehydration, pain management if required, and maintenance of the charts, that is vital sign and intake and output chart. The main treatment, it is antibiotic regimen to start. It depends on the culture and sensitivity report. The drug choice is gentamicin 2 mg per kg IV loading dose, followed by 1.5 mg per kg IV every 8 hours, or we could give ampicillin 1 gram IV every 6 hours. Another drug of choice, it is cefotaxime 1 gram 8 hourly. Another metronidazole 0.5 gram IV is given at 8 hours, or 500 microgram IV given for 8 hours. If the infection is severe and there is a presence of abscess or the infection spreads, surgical management also could be opted. In case of pelvic abscess, should be drained by colpotomy under the ultrasound guidance. Hysterectomy, it is a procedure where the uterus will be removed in case with rupture or proliferation. In case with rupture or perforation having multiple abscess, gangrenous uterus or gas gangrene infection, hysterectomy is performed. So these are some of the curative measures, including medical as well as surgical management. Next, we will move on to the nursing management. In this, the nursing diagnosis include pain related to infection site, procedure or treatment, risk for infection related to childbirth and physiologic stress, spread of infection, risk for infection related to exposure to others and equipment, lack of knowledge of infection transmission, anxiety related to interference with recovery, risk for altered parenting related to limited contact, pain or inability to focus or attention on the neonate, risk for altered parent-infant attachment related to client's inability to give attention to the neonate, situational coping related to infection and interference with the child responsibility. Pain related to infection site, procedure or treatment. In this, as a nurse's role, assessing the pain level using a pain scale, administer prescribe pain medication as needed and evaluate the effectiveness, encourage relaxation techniques such as breathing and guided imagery to help reduce pain perception, apply non-pharmacological measures such as cold compression therapy, positional changing and relief pain, education regarding the treatment on pain relief technique. Risk for injury related to childbirth and physiologic stressor or spread of infection and lack of knowledge about infection transmission. Monitor vital sign and sign for infection, provide hygiene education, include hand hygiene, perineal care and wound care, educate patient and family on the infection spread importance of minimizing exposure, encourage to use the personal protective equipment when in contact with the patient. Anxiety related to interference with recovery transmission, encourage expression of feeling, and provide reassurance by giving a supportive presence. Teach relaxation technique, deep breathing exercises, meditation, and progressive muscle relaxation. Involve family members or support person to provide support. Risk for altered parenting related to limited contact, pain, or inability to focus attention on neonate. In this, the nursing intervention includes encourage skin-to-skin contact, teach positioning technique, involve the partner or other family member, and provide emotional support and counseling as needed to boost the mother's emotional status. So with this, I am summarizing today's lesson. So we have discussed regarding the puerperal sepsis, which is an infection of genital tract during the postpartum period. The predisposing factors, which can be categorized based on the antenatal, intranatal, and the postnatal factors. The main diagnosis, it is the culture and sensitivity test, which can be either done by the swab test or through the urine or through the blood test. Then puerperal sepsis, which is preventable and curable if taken and effective measures. So I am concluding today's topic. Puerperal sepsis is an important public health problem contributing to maternal morbidity and mortality. Majority of the predisposing factors are preventable. So these are the references. Thank you.